Now, on the 3rd of March this year, we will be talking about ears and hearing, because it's going to be the World Hearing Day this year.
Is the world
Ears of years of hears.
what?
Higher. Let me quote this man called Ghebreyesus. Tedros Adhanom Ghebreyesus is the WHO Director General. He says hearing loss has often been referred to as an invisible disability, not just because of the lack of visible symptoms, but because it has long been stigmatized in communities and ignored by policymakers. That's why this year, as the WHO designates this as the World Hearing Day, you're talking about changing mindsets. Let's make ear and hearing care a reality for all. Now we have somebody who understands a thing or two about ears and hears, and this year he's our guest. His name is Richard Mwangi. Richard is a consultant audiologist and also an audiovestibular. What is that now?
Audiologist. You know, there are some people who spin deep.
At your job is an audiologist.
Yes.
What does that mean? Fundi wa mitambo.
Ours is about hearing and balance.
Hearing and balance.
Yes. So when you talk about audiologist and audiovestibular, basically we are talking about human hearing and balance. Because basically that's what keeps us in equilibrium. That helps us in staying on course.
Balance ya kusimama.
Kusimama, kutembea, kama umelala.
Equalizer ya masikio.
No. Balance. what people call vertigo, or when you have got, waking up with a spinning effect. That's the kind of balance we're talking about.
I see.
Yes.
Well, okay.
Maswali ni mengi, City.
Yeah, I hear
Welcome
you.
the man.
I hear
you. You hear the guy.
I hear. I don't understand, but I hear.
Very good.
Yeah, well done.
I hear.
We have formed a nice entry into this conversation. First of all, Mr. Audiologist, Audiovestibular, we would like you to listen and hear today's proverb with this year man, City Muga.
This year, 2024.
In this year.
Let's do this.
Okay.
Right.
This week the proverbs are from
The Republic of Benin.
Alrighty.
Okay. Very good. Whose capital is?
Porto Novo.
Well done. Largest city is
Cotonou.
Yes. Used to be capital, but you know how it is.
Yeah.
Starts off as being capital, becomes commercial capital, and then you get a political capital.
Right.
Right.
Same is Yolo soon.
Even here, Isiolo might soon be capital of Kenya,
Yes.
for all you know.
Yes.
Death is certain, but does not make one sleep in the grave.
Death is certain,
Yes.
but does not make one sleep in the grave.
Yes.
Richard, what's your interpretation of this? Did you hear him well? Would you like him to repeat?
Death is certain, but it doesn't make one to sleep
In the grave.
in the grave.
No, it doesn't.
I mean, that's the certainty about life.
It is. It is. But where does the sleep in the grave come in? We've established that's a definite, this certainty. You're alive, next stop, infinity. So now, why sleep in the grave or not sleep in the grave?
Why sleep or not?
Yes, it's just your thoughts. This is one of those questions where you can't be wrong because it is your thoughts that we want to hear. It's how you interpret it, how you see it. Sometimes you actually don't see it, but even then it's still okay if you don't see it.
It's by choice.
Yes.
So I'm correct.
Yes, you are.
Thank you.
Yes.
Very good. Now ask the question.
The question that I wanted to ask is this. The hearing, audio, I get.
Vestibular.
But balance, let's start with something simpler. Vestibular is technical. Balance, where does the balance come in? What has my hearing got to do with my balance?
Today I brought you a model of the ear so that it will simplify CT's questions because I've been following you and this is the model of the ear. Okay? This is what you see. Commonly people say it's the ear.
It's this.
But here we have the ear canal. The production works happens there. Okay? We have the eardrum. We have what you call ossicular chain, where you find the smallest ear bones. So there's one called malleus, incus, and stapes. And then here we have semicircular canal, which helps us in balance. And here we have the cochlea, which is the inner part of the ear, or what you might call the hearing organ. So the balance and hearing, they are related. And this is what we specialize in. So your balance is important because it is just what you trained in. This is what we call vestibular system, and this is what we call the cochlea.
Okay. Yes, walk us through this and tell us how it is that the organs that you've mentioned, that vestibular area, what it is and how it is they affect one's balance. I am walking, I can hear, all right? At what point does that capacity, the ability for me to take in the audio, how does it influence my balance?
So in this organ here, there is calcium carbonate stone-like structures called otoliths. So when you move like that, they send the message that you're moving forward. When you move back, when you move side, when you move, they send a message to the brain that that's exactly what you're doing. Now, when there's a problem is that they get dislodged in some time and they lie freely within the canals.
What dislodges them?
One of the things is in medicine you say it's idiopathic.
Meaning?
Not known cause. The other one is that...
But it happens.
But it happens.
Okay.
But another thing is that those people go to the loud sounds and there's so much of booming music. The speakers are too loud, might dislodge this one because we know sound is city. Sound is energizes it.
I was told this sometimes back.
So you are one of our patients.
Well, yes.
But just before I finish, an accident also can happen.
Yes.
A disease can happen. Yes. But also, as I said, it can happen of not known cause. But treatment is very simple because about 90% of the balance issues are done by rehabilitation. So these kind of maneuvers we take through the patient, try to reposition them.
So are we saying that the entire system of balance that I have in my body is nestled in that little area there?
Two sides, this side and that side.
The two semicircles.
The
semicircular. Yes, semicircular canals. So the right ear and the left ear.
Okay.
Yes. Welcome to my biology class.
You get it?
Yes. No, I'll tell you where the penny dropped. I'm thinking of any time, for instance, I'm in a place and someone turns on the music very loudly, and the effect, that's what I saw. The effect it has, I'm disoriented. Now, that disorientation means I will not want to move because I'm not certain that I have the balance. That's what hit me. And I said, I see. So I can see the effect of what he's saying.
Okay.
Yes.
So then what makes us hear? Looking at this model here, what happens? Sound, from what we remember hearing in school, sound goes somewhere, bounces off something and comes back into the front. And that's when we hear sounds. What exactly is that?
So this being the model of the ear, the sound comes, of course, from here.
Yes.
Okay? Taken through the ear canal.
Yeah.
This is the eardrum here.
Yes.
What you're saying bounces. This sound, this moves.
Yeah.
Okay? Like now I'm talking, this vibrates. And then moves this, all these three parts, three bones in the ear, then comes to here, and then this is the final part of amplification of the sound, and then to the brain for interpretation.
Right.
So it makes us to understand, and that's why, we normally say there's hearing and there's understanding.
Okay.
So if the hearing is not as good, then the understanding will be challenged.
Okay.
Yes.
So now, in the instance of hearing loss or deafness, what happens here that then does not allow an individual to hear?
So there are three types of hearing loss, just to answer your question. There's one, which is, we say it's conductive hearing loss. That just means that the conductivity of the sound is not very good. So this one happens here. Now, that can be as a result of wax blockage.
Okay.
People who use earbuds or Q-tips, which is wrong. You're not supposed to use them in your ear.
They're called earbuds.
Yes, earbuds or Q-tips.
Those Q-tips.
Yes, you're not supposed to use them inside the ear, and all the brands are written there. It's small writing.
Yeah.
So you're not supposed to use them, because what you do, you push wax further
in.
But I normally say they are deliberately made white so that it can come out, brown, and you can see like you're doing a good job, but that's not your job to do it. It's the ear cleans itself. But having said that, is that there are 3 types of the hearing loss. Conductive aspect happens here, and also can happen when the eardrum is not functioning well, maybe perforation, maybe there is a fluid in the middle ear.
Perforation meaning it has a hole.
It has a hole.
Okay.
And that's one of the things that also when you use Q-tips, that you can lead yourself to injury, and that can be quite a serious thing. So another thing is that you can have both sensory neural hearing loss, where we say the hearing nerve or the cochlea has an issue, this part. Okay. The third one is mixed of both.
Yeah.
That you have got maybe wax impaction, maybe you have perforation of the eardrum, maybe you have fluid in the ear, and still you have the hearing. And that one also now makes us understand the different levels of hearing, because there's a mild case, there's a moderate case, there's moderately severe, severe, and also there's profound case.
Okay.
Profound being the worst case scenario.
So before we get to the profound, it sounds like everything else that you've talked about, whether there be a blockage, sounds like that can be removed. Whether you talk about a perforation, sounds like that can be closed. When you talk about some kind of obstruction, the object can be moved. So then, are there levels of hearing loss that can actually be reversed?
Some, yes, especially when you talk about conductive hearing loss. When you say about conductive hearing, if it is wax cleaned, that's good to go. If it is a fallen body, insect or cotton bud stuck inside there, it's removed. If it's a perforation of eardrum, the ENT surgeons are the one who do the operation to try to seal the hole. That is done. But when you talk about sensory hearing loss, it cannot be reversed. But it can be prevented in one case, where we talk about noise. So because noise pollution, or there's something called noise-induced hearing loss, where you find that the noise is too much and it's damaging the hearing. That can be prevented. And the WHO is very categorical on that. Reduce the much noise you expose yourself.
True.
They'll argue that we wear sunscreen when you go to sunny beaches of Diani to protect ourselves from sunburns. We wear sunglasses to protect our eyes. But also ears need to be protected. But also, as the Eric said, it is one of the invisible disability. So ears are somehow forgotten, and we forget all about taking care of them.
Okay, before we go to some of the other issues that we would suffer from, I must admit, I once put a Q-tip in my ear and the top bud
broke and got stuck inside.
Yes. And I had to go to the dentist. I had to go to the doctor, and he put this, super duper machine in it to then remove it. But I remember, sorry?
You had panicked.
Oh, properly. I knew I was deaf. The world was ending. But I remember the whole day just putting, because I was uncomfortable. It felt really cloudy up there, somewhere in there. I couldn't, So I imagined, and then I heard another doctor say at some point that anything smaller than your elbow, you should not put in your ear.
That's true. Yeah.
Right?
Yeah, that's true. Yeah.
Anything smaller than your elbow should not go into your ear.
Yes.
So then is the ear self, like other parts of your body which are self, or they will expel things naturally? It seems that the ear is pretty hidden. This is just a small part of it. It's pretty hidden. So how would it then, you say it's self-cleaning of wax, how does it expel that on its own if it's so, it's well into the cavity?
The skin inside the ear is like a conveyor belt. So it slides the wax. So we're talking about this skin here. The wax production happens somewhere here. So it slides out. And that's why sometimes when you're showering and you put a bathing towel, you find you're coming out with wax. That's a good functioning ear. But most people, what they think is that there must be a lot inside, if at all I can get some of it with your finger. But that's wrong. That's wrong. You're not supposed to put anything. As the good doctor told you, that's how it is. The biggest part which should go in your ear is your elbow. Of course, that means the difficulty with it. I mean, you cannot do anything to it.
What is wax and why is it important?
It's very important.
What is it?
The wax helps in trapping insects. That's why when you if let's say a cockroach or something like that of that size goes in your ear, goes in your ear, it doesn't go way too far. It gets stuck somewhere. Of course, it traps dust and other.
So the cockroach gets trapped in there.
Yes, it cannot move as far.
I just want to know where you
just need to. You just need to remove. You look like you've been a couplet of it.
Yanni. Okay. So it's Friday, isn't it?
So it prevents
it
external
prevents exactly
things from
entering the ear.
Where does the wax come from?
It is one of the secretions from the body, but it helps. That's its work.
So is it produced from where is it produced? Is it from lower down the cavity?
Both sides.
So it just seeps through into that membrane.
It also protects the skin here because it's quite delicate.
Okay.
It traps the dust, traps the insects. So that's why we are not supposed to interact.
Is there a good amount of wax and a bad amount? You talked about some of the conductive hearing loss being excess wax.
Yes.
So you don't want us to remove the wax.
Don't remove the wax because that's not your job to do it. The ear will do it. And if at all you have query or a question of how much wax it is there, let someone check, but you cannot do it by yourself because as much as you want to use those Q-tips, you don't know how far you are going in. Okay. And I hear people saying that stretching is nice,
my friend.
Look at you being a culprit.
When you do like this,
no, you're doing that
and you always have to
exactly, and you get absent-minded. Leave it there and you sleep on that side. What will you do? You just perforate your eardrum. Right. Or even somebody just passes there and just knocks. You're doing it and you forget your worries and you just think about the H-ness and the sweetness they say about it. So it is not good at all. We've had cases of people having those accidents happen in their ear. And they can be corrected. Some can be permanent. So it is not good to use those Q-tips at all.
Okay. What happens when you get water in your ear, and of course you shake your head about and you can feel I don't know how else.
That's a good one.
Onomatopoeic, are we? Okay, go on.
You just leave it will come out.
Oh, is it?
Yes.
Because we spend the whole day doing this and
because you see this part is so sealed, the water will come out to this point. So just leave it. And sometimes you'll feel very hot water coming out from the ear. You feel so much of relief.
Yeah.
Of course, when something gets in your ear, you panic because first of all, you cannot see it. And you don't know what kind of impact. You don't have any knowledge about what is happening to your ear.
Yeah.
Panic, it's okay. But you see, don't put things. The water will definitely come out. But also what you advise is that if you have a perforation inside the ear, don't allow water to get into the ear because of course this part is not sealed, okay? So you'll expose other areas, okay?
One of the things that is very common with the human beings is habits that we tend to have when we're adults and grown up and when we get older begin in childhood. This knowledge that you're now imparting, is it something that is readily available to children of school-going age from a very early age so that they understand? Because children will pick up good and bad habits from their parents. And given the importance of the ear and the likelihood and the ease with which you can actually damage it, is there a program, is there a process, are there ways in which it is ensured that people who are still at the stages of learning at the very earliest stages can actually get to have this understanding that we are now having now?
I'll say yes and no, depending on where someone is. Because some of this information nowadays are readily available and you find people reading it, at their fingertips. But now you see there's some areas that are less fortunate that you cannot read about all this, about the hearing and things like that. Now, it is in 2007 that the World Hearing Day was created for the betterment of the ear and hearing healthcare, because we need to impart this kind of knowledge to each one of us who is can be exposed to this hazard of perforation, this hazard of the noise, this hazards of having balance issues, and they know what kind of solution they need.
Okay. Yeah. There are a couple of questions that are coming in, and maybe we'll have some time to look at that. But one that is here right now is one of two. When my daughter stands up in a hurry, she gets either a blackout or dizziness. What could be the cause of that, and how do you deal with it? And then in addition to that is the same happens in addition when asleep. When I turn quickly or sleep facing up, I get an extreme headache or partial blackout. And they feel that sensation in here.
To answer the first question is that about the daughter, maybe you don't want to know how old is the girl?
15.
15 years old. But there's always some simple clinic assessment that you can do to know where this kind of dizziness or what she's trying as a blackout originating from. Because all these, as I explained to the semicircular canal here I was showing you, is that they originate from different canals, and you have to look at it clinically how it is. Another thing maybe the family doctor would want to know is the blood count, all those kind of lab test. But also in our area is that to know where is the balance originating from, is the child having the other issues, things like that, so that we can square know that it is balance issues, is a dizziness, is vestibular, disturbance or something like that, and then it is our case to deal with.
Oh, okay.
Yeah.
So when all those other things are ruled out, then it comes.
They can even come. They can run. They can even come to us first, and then we see whether it is one of our case that to deal with. And most cases you find it is one of these cases that you have to deal with, and then we do the rehabilitation. Now there was a second question about this person who
asleep at night, and then unable to sleep facing up, and when they turn quickly to one side, they get an extreme headache or partial blackout. Sounds like vertigo. So
yeah, partial blackout, I would want to think is trying to explain the vertigo part of it. And in fact, that is a person should visit an audiologist, because that is a very rehabilitative case. It can be done, and that it's cleared forever. Because what will happen is that it comes within a few seconds. They'll have to close their eyes because the world seems like they're spinning. They have to hold their bed strong because they feel like everything is moving upside and down. So they have to close their eyes, what they call a blackout, and then try to see the situation resolving itself. It will resolve so fast. But then you don't know when again
Another
it may
one will
happen.
happen.
Yeah. Some may find that they are driving and they had to turn like that, and then it happens. So it is a case that need to be addressed. As it is very easy to rehabilitate. Yes.
On the 3rd of March this year, Sunday, we will be marking World Hearing Day. And here with us in the studio is an ear expert. He is Richard Mwangi, a consultant audiologist, Audiovestibular. We're talking about hearing, just getting to understand hearing impairment and what it means. And very many instances where maybe this could be corrected or this could be rehabilitated, I said. Many things that you've taught us this morning so far, and this is about just taking care of the ear so that you maintain your proper hearing and balance. You've told us that there are various degrees of hearing loss, okay? When can one tell that I'm starting to get into hearing loss?
So in matters of hearing loss, it's a very gradual process. So you find that in most cases it's not you realize, that's in most cases, but some cases you might realize that you cannot hear very well. So people start telling you, look here, we said about this yesterday, but you said yes, and now you're saying no. Your volume, when you're all alone, the TV volume is too loud. You're always using your phone on high volume, or you're using your volume on loudspeaker. So it ends up being a case where the sound you cannot be able to hear as much. But now you might not notice because somehow in a quiet world of yourself, you've got a degree of hearing impairment. But other people who you live with, they find that the sound is too much and they would want to have you checked for your ears. So in fact, what we do when a patient comes in, we ask the question is that, how many years have you had this problem? That's because it takes some years for somebody to realize that they have a problem. But then there's some other case that you can sleep today and wake up having a hearing problem, which is called sudden hearing loss. That should be treated as emergency. It deserves. You should not wake up with a hearing problem and just say, it will resolve. You should go to the hospital as soon as possible. So how to know the degree is that there's quite a number of tests are done. The test that you can do for the adults and the one you can do for the children. The one is, like the way you're hearing the headphones, and then we make you understand that there'll be a sound faint sound that will be presented to you, and as much as you hear the sound, you keep on pressing. Yes. Now, that cannot be done to a child who cannot understand simple instructions like that. So we normally make them sleep naturally, deprive the child sleep, and then they can do what we call auditory response test.
Right.
It's a brainstem test to assess how much the sound this child can be able to hear.
Occupational hazards.
Yes.
See, I'm wearing these things.
Yes.
So that I can tell the balance, that all the mics are same and all.
Yes.
But then it means I'm hearing you closer than how Ndu is hearing you.
Yes.
DJs who are constantly playing day and night loud music in a club,
In a studio.
in a studio, are there occupational hazards that predispose you or pre-expose you to hearing loss?
Yes, they are.
And what do you do about that? Like, which ones are there, and what can one do about it?
No, even not coming to the studios and the DJs. Let's start with manufacturing industry, where you find that the nail manufacturing industry, the barbed wire company, the cement industry, those people are exposed to too much noise, but you can take care of it. Job must be done anyway, but you have to use what you call noise plugs. Those are the things that sometimes in the airport you can see guys hanging them around here, and when they got the noise, where it's too much noise, they put it inside the ear. It can be as simple as that, and it helps in preventing what you call noise-induced hearing problem. Now, coming to the music and the DJs and the loudspeakers, now that can be controlled. I remember some years back, you'd sit somewhere enjoying the music, and you can feel you're really enjoying the music. Nowadays, it is the noise. It's no longer the quality of the music, it's how loud it is. Now, that is what is causing most of young people have this kind of hearing problem. We used to say that the hearing problem, especially where it's age-rated, starts from about 60, thereabout. Now, the hearing problem, it is going down because too much of listening, or too much even the wearables devices in the market. You find even people walking around the streets and you hoot behind them, they cannot hear you because the sound that you're exposing themselves inside the ear is already too much than your hoot. But you can imagine how a hoot it is when it's close. So they exposes them even to hazard of being knocked by the cars, being knocked by the do-these guys, and all that kind of thing. And also they're causing quite of a damage to their ears. It might be gradual, they might not notice that because they're enjoying the oomph of the music. Okay? But in the long run, they'll find that this is not good enough. And also, people in call centers are new now, is that we normally have something we call 60-60 rule. Use the volume at around 60%, because so many devices have controls that you can see, in about 1 hour, and have a break. That's good enough. And of course, the kind of headphones you're using, they are very good. The traditional way of headphones, they are very good. Reason, because the sound pressure escapes from where the contact with the skin of the headphone. But you're finding people having a stylish one, put inside the ear, noise cancellation, all those kind of things. I mean, and you use it for hours. That is causing quite of a damage to the ear.
Okay. How would you tell if a baby is either hard of hearing or has total hearing loss?
That's a very good
non-present.
question. That's a very good question. Now, this is something we normally talk about as audiologists called 136. When the mother delivers, there's something called newborn screening. See, some years back, we used to say it was, did the baby cry, was the color of the skin, the weight, and things like that. Some of the things that are included now is that the hearing screening, the eye test, and things like that, where we just use a very simple device. What you're looking for is pass or refer results. Okay, it might fail the first time because the child might be crying, be fluid in the ear because of course, the process of giving birth, and maybe the machines are running in the room, all those monitors. But then, why it is 136 is that you can repeat it after 3 months.
Okay.
And then, if this child passes, there's a child B. If the child fails, let it be repeated at 6 months. And this time you'll be thinking of doing a diagnostic test. All this you're doing 1-3 is screening tests, just to see whether it's a pass or a refer. At 6 months, you can repeat this pass and refer test because it doesn't take time. It's about 2 minutes or less. Then you go to do a diagnostic test. When you're doing the diagnostic test, you're trying to test in different loudness of the sound, what you call decibels in hearing, in audiology. You try to test how loud is the child responding, or the child you can get a waveform. That's what we call it.
Okay.
We call it a reproducible waveform when you try to get it. And then you can say it was maybe at 50, maybe at 60. What that means it is that the same case, it is more a different way of doing the other test of hearing.
Yes.
But now more where you don't need the child to understand the information they're giving them. But you can get to know whether it's a severe, whether it's moderate, whether it's a profound case.
Okay.
So with that, an intervention can be done even when the child is 6 months.
Okay.
But what people do is that, it's good we have to accept that people get into a denial. But it's always good to, have a second opinion. But in most cases, you'll get the same result. Don't delay.
Sure.
Let this intervention be done at that early age because it can be done. Don't hear, these people saying, friends telling you, oh, the uncle talked when 10 years, 5 years. That doesn't happen scientifically. So take intervention, even at 6 months, 7 months.
Yeah.
This child will develop speech and language as per the peers, will go to normal school with others, will compete with others in school, and later on in life, and will be able.
So what are some of the interventions that we speak of when we talk about at 6 months? I read a story that a lady was in the kitchen and pots, and her child was playing, and pots fell, loud clanging noise, and this child didn't react. So that's when she realized, something here could be wrong. But at that time, the child was playing, could sit up on its own. So at that age, what kind of intervention? I mean, for me, the first thing that we think about are hearing aids. But are we talking about surgical interventions, things that can be done to reverse what may have gone wrong?
Yes, and just so to go back to that lady, a pot fell, is that, there's a milestone of development. Any parent knows that at a certain age, a baby will bubble. Maybe around 8 months, respond to sound. When you clap, the baby will turn smiling. Some of these things, the caregivers, the parents, so just check. I mean, you're so in love with this newborn child, and you play around. Even if they cannot understand your language, they can smile.
Something react.
They know your voice, and at least they are learning. So if there's no at all reaction at all, even if the baby is facing away and you clap behind, and the baby is not turning, you call the baby's name, the baby is not turning, and some of these things should be ring a bell that, let me just have a screening test done. Now, talking about the intervention is that depending on the severity of the hearing problem, there's a different way of doing it. So for the children who have got severe to profound, hearing aids do not help much.
Okay.
So there's surgical intervention called cochlear implants that is done. But from mild, moderate to severe, we find most cases is that the hearing aids works perfectly. And there's no age that will say, now the child is I'll wait. Now the child has been diagnosed moderate hearing loss. I'll wait for about 2 years. No, it doesn't work like that. Those delaying things will make the child get delayed everything from develop the speech, language development, and also in school.
It's interesting that something as small and yet so sensitive and crucial as the ear, I'm talking about myself now, what I'm finding fascinating is just how little I know about it. And how, because of that ignorance, I can actually go about what I consider to be my daily business in my relating to my ear, and in the process actually cause more damage than I could ever have dreamt. I'm going back to the question I asked earlier on, and for a very good reason. One is taught anatomy when one is in secondary school. I guess you start introducing primary school and you're taught the ear and you're given the parts and how exactly it works. And there are mentions of what you should understand about the ear, the parts of the ear and what they do and so forth. Now, even as we have this discussion, there are all these people whom one comes across who belong to a certain society in our country that deals with people who have hearing impairment. Okay? It is said some of them have been brought about by a result of certain diseases that they have. Now, my question, what are some of the diseases that are prone to the ear? Diseases that are common, the diseases that then affect the hearing and sometimes to the point of a complete loss of that hearing.
Thank you for your question. And just to make a brief understanding on that is that we talk of hearing problem as either congenital, that is somebody has been born with this problem, or it can be acquired. Okay? Congenital, maybe the mother had complication during pregnancy, things like that, or some diseases that caused the ear not develop the way it is supposed to. Now, acquired is now you find most cases where you talk about diseases like mumps, where we talk of some medication like quinine, what we call medication we call ototoxic. Auto means that they are harmful to the hearing nerve. We've talked about noise-induced hearing loss because of the noise. We also talked about age-related hearing problem or accident, where you find that the hearing had been damaged. So there are quite a whole topic on the causes of the hearing. But now, when you get to the cause, other might not be because it might be hereditary. Okay, so that you find that in this kind of family lineage, there is a hearing problem, or somebody had a hearing problem. So all those are causes of the hearing problem. So to answer your question is that diseases like mumps, measles, might contribute towards the hearing impairment. And that's we say it is the group of the acquired hearing problem.
Does hearing loss come, let's ask it this way. What about pregnancy then results in partial loss of hearing, that for some women, that hearing has never returned?
So you asking, now the parent gets a hearing problem.
The mother
who's
pregnant.
Yes, those cases are there. And there are not many, but they are there. I've seen in about 18 years of practice, I've seen a number of cases. It is otosclerosis. Now, it's not well understood what happens. Now, what that means is that this part gets quite of a bony structure growth that makes these three bones fixated. Okay, so they cannot be able to move the sound. So when the sound gets up to here, these bones, they are not vibrating the way it's supposed to vibrate. That means the nerve is good, but still, because the sound has to go through the whole canal, the eardrum, the circular chain, the three small bones to this part, they are not able to move the sound. Okay, so it is not well understood.
The connection between pregnancy
yes, but that case is there. Yeah, because you find that it might be mild, moderate. The best approach to do is just use the hearing devices as prescribed.
But before pregnant, she doesn't have this condition.
Yes,
she gets pregnant, gets the condition.
Is
it not reversible?
It can be reversed by surgical intervention. But most doctors would want it to be the safest way possible using the hearing device.
Okay.
Yes.
Hearing devices.
Yes.
It's part of rehabilitation, right?
Yes.
So once you've diagnosed somebody, yes, you have one level or a degree or another of a hearing problem, then we start doing something about it. When you are given a certain hearing device, does it lose its power over time? Do you need to keep changing it like we do with glasses?
Yes. Now, what happens is that the hearing loss, it's progressive. Remember here, this hearing device is not coming to treat. There's already a case of maybe a mild, moderate, severe case. But also, you use the hearing aid. That's why it is a hearing aid to help you hear what you cannot be able to hear. It is not coming to do any corrective measures or reverse anything. So another thing that happens as you continue, you're getting old. Okay, another thing we have talked about is that there's age-related hearing problem. But how to monitor that? We always advise have an yearly check or even 2 years check of your ears so that you can be able to monitor with your audiologist. Now, will the hearing aid lose power? It might, because hearing aid, they are prescription devices.
Right.
And that's why, when somebody calls and tells me, give me a quote. No, we cannot give just a quote. We want to see your hearing test so that we can give you a quote or according to the much power amplification you want. So it might get to a point that the hearing aid is not sufficient enough for you. About 4 or 5 years, you have to change the hearing aids so that we get to a new device, new technology, and things like that. And they've come very nice hearings nowadays. It's not or what you have in mind, a beige big thing behind your ear. No. They're nice, far much better than wearables people are wearing. And these people are even getting advantage of having their phone Bluetooth connected there. They can use their phones once again. They are rechargeable. They are nice nowadays. It's not what has been stigmatized. No wonder we have this theme of
so it's not this
mindset.
thing that you will see protruding from your ear and
yeah, it might be that
thing.
one because different severity hearing problem or different degrees have got to be approached with the different devices. But in most cases where you find most people are about mild to about moderate severe and severe, there's some nice hearing devices that can be pulled and they're stylish. Yes, so the stigma associated with the hearing aid, it should not be as such. Some years back, eyeglasses were also the eyeglasses were also stigmatized, but now is fashion. They're nice
pieces of bottles.
Yes,
Thick like that.
yes.
Let's talk about balance. So how do you diagnose that somebody has a balance issue and what do you do?
Now, the most important thing is history taking when you're diagnosing the balance. You have to listen to the patient clearly, give them giving their experience and description of it. That is very important. So that as the patient is telling you the history, in your head as a clinician, you are eliminating some of the causes and then you are narrowing down to what exactly it is. Now, when you narrow down, you have to do some specific test, where you put some special goggles inserted with the cameras and instruct the patient, there'll be some squares, dots on the screen, follow them. What you're trying to do is just to study how you study the balance through the eyes, so how it is and which side it is might be affecting. In most cases, you find people complain on one side and say, when I'm turning to this side, I have to be slow and very strategic, that I can support myself because I might fall. Or the other question was asked by somebody, when they are turning the bed and they have to close their eyes, a short blackout. So those kind of description, they are very, very nice because they are narrowing down to the clinician's diagnosis. Then after that, even if you don't have this specialized equipment, you can put a patient to the examination bed in the clinic or in the hospital. If you know what you're looking for, you can see it by the eyes because you just stand the patient, in a strategic way and observe the movement of the eyes and most patients will try to close their eyes at that point. Just tell them to open their eyes so that you can see how the eyeball is moving. You'll end up concluding on what kind of balance issue it is there, what kind of vertigo it is there, and you'll be able to help this patient in rehabilitation.
What do you do? Is it medication? Because hearing you can hear, so
yes,
you even go into hearing aid.
Now, depending on the balance, now let's just talk about the commonest balance issue or vertigo, which is called benign positional vertigo, or what you might see most doctors writing BPPV. Now, we do what we call canalith repositioning. Okay, that is just trying. Remember CT's question: what gets dislodged? You're trying to reposition to where they belong and where they have moved from. So by doing so, you're trying to treat or rehabilitate that business, that balance issue. And most patients, we've seen even some coming in wheelchair and some walking back, and because it is the vertigo is quite of a serious issue that patient has to prepare themselves on what next they're supposed to do, even if it's a step. So what normally happens is that we try to reposition, or what we call in medical terms is called Epley's maneuver. So we try to do that.
So this is surgical?
No. It is by hand. Okay. Because you know what it is. As per the history you took, the duration of the balance, the vertigo, how it lasts. Other cases can be treated by medicine. So if it is not our case, because sometimes it's not our case, we send back to the ENTs, we send them to your GP, we send them to your family physician, because it can be also as a heart condition also, where the BP is quite high and then the patient gets so disoriented. So it is quite of a teamwork that need to be done. But in most cases, you find that it is our work, and about 70-75%.
You'll be able to sort it out.
Yes.
Final question. Somebody's asking about ringing in the ear. Or sometimes you're in a vehicle and then ears pop. suddenly everything is so loud in the same vehicle. What happens here?
Now, the ringing sound in the ear is called tinnitus. Okay? And it can be ocean-like sound, it can be cricket-like sound. People might, you might hear, somebody saying, I think it's raining, but it's not actually raining.
Right.
So this sound, it's only an individual who can hear it. And it might be so loud that, city seated next here, and I'm the one having this tinnitus, or the ringing sound. I'm wondering, maybe the loudness I'm hearing, maybe city also is hearing it. But it is just you hear it. Now, one cause of that is the hearing problem. Second, wax impaction. 3 might be an ear infection that is there. Right. So it has to be checked also. If it's wax cleaned, good to go. Hearing problem, given the hearing it, life goes on. An infection is treated.
So ukianza kusikia vitu zako, go see Richard Mwangi. Richard is a consultant audiologist and audiovestibular. He's been our guest, understanding hearing. And it's important because this Sunday, the 3rd of March, the world will be marking World Hearing Day. Thank you very much for joining us today, Richard.
Thank you very much.
We've heard and learnt a lot from you today.
Indeed.
Welcome to my class.
Very good. If you'd like to get in touch with Richard in future, just talk to us. We'll put you in touch. Keep it here for more conversations.
This is the Situation Room, the only way to start your day.